A major health system has many challenges. What are the major challenges facing this organization?
I think right now in healthcare in general, and certainly for us, finances are the major challenge we run into day to day. Now, there are a lot of problems, but as with many problems, sometimes there are problems that money would really help. Right now, for instance, we've got more patients that want to get into the medical center than we can take care of, and really we're short on two different things. We need more nurses and professional people, and we need more capacity, more buildings, more facilities, and that certainly takes money to build those buildings. Some of that's going on now, but those are the kind of things. Having the money to meet the needs of our community is really what we're struggling with right now.
We hear a lot of news in the hospitals about being on diversion. What exactly is being on diversion mean? Diversion,
I'm glad you asked that question. The problem I just mentioned about having more patients that want to come into the medical center than we have the capacity to take care of, when that happens, then we go on diversion. Now, we can go on diversion because if our ICUs are all full and we don't have an ICU bed and somebody in another county wants to come up, then that can cause us to go on diversion. We can go on diversion because we don't have enough staff to staff a particular unit. So rather than take on patients and not be safe, then we do that. If the emergency room is full, those kind of things cause us not to be able to take care of patients like they ought to be taken care of. And when that happens, we go on diversion and just say, we're full. If we're talking to Cordele, can you check with Albany? Can you check with Columbus? Can you check with somebody else? And that's what diversion means.
Nurses and RNs and those kind of positions, you need a lot of those?
We do. We could use 200 nurses today if they were out there to be hired. That's why we're working so closely with Macon State College and with Georgia College over in Milledgeville to make sure that we have, in their case, enough nurses to staff our floors. That's a great career for young folks, and I encourage that to parents. I encourage them to get people into the health careers, and specifically into nursing. We employ 1,500 nurses, and again, we could hire 200 tomorrow if they were out there.
When we talking about nurses, you're talking about registered nurses, LPNs?
Registered nurses are the primary. We do hire some LPNs, but registered nurses are really the backbone. There are a lot of other health professions, such as LPNs and EMTs and respiratory therapists and medical technologists and x-ray technologists, lots of others, but usually we employ 25 to 50 to 100 of those. But 1,500 RNs, that's the big backbone of hospitals.
It seems that if the medical center always has some projects going on. I see construction everywhere I go. I look around, you're always building something. Do you ever stop it? It just continues to grow?
No, even if we weren't adding anything new, we've got, 1 million square feet. And even if you only remodel every 20 years, which is not a lot of remodeling, that'd be remodeling 50,000 square feet a year just to keep it modern. So we always got that going on. But then you talk about wanting new services or needing to expand, like the emergency room. We expanded that several years ago. Right now we've got the big heart hospital constructions going on down on 1st Street in between Pine and Hemlock Street. That's the biggest single project we've ever undertaken. It's $80 million. It's going to add about 200,000 square feet. It's a 9-story building, and that's where we're going to have all the heart services in. So there is always something going on because the patients need it, and if the patients need it, that's our job to try to figure out how to get whatever it is they need taken care of.
Approximately how many people does the medical center employ?
Approximately 5,000 full-time and part-time. The Central Georgia Health System is also included in that number. Most of them are employed on the downtown campus, but we've got other facilities and other services with the med centers, and we've got Carlisle and the rehab hospital and the wellness center and other areas, but about 5,000 altogether. We're the largest single employer in our area with the exception of the Air Force Base.